Hey guys, it's Dr. Adam Nally coming to you live on my website page, Dr. Adam Nally, which is my Facebook page, Dr. Adam Nally. I'm trying to use my iPad to see if the video quality is any better with my iPad versus my iPhone. So we'll see how it goes. And I'm not quite sure where the questions are going to roll from since I have my iPad turned sideways. But it's been a busy week, and I thought I would try to jump on here for you guys and answer any questions that you might have around the coronavirus and viral infections. And I know there's a lot of anxiety in regards to people, their perceptions of what's happening and what's occurring. My name is Dr. Adam Nally. I'm a board-certified family physician and a board-certified obesity medicine specialist. I practice in Surprise, Arizona, and I've been in practice about 20 years. I do obesity medicine. I specialize in ketogenic diets, carnivore diets, and intermittent fasting with patients. And so let me know if you have questions. I am not seeing any comments, so I don't know if the comments are coming up in this partition with this way. Oh, there they are. Hard to hear me. Uh-oh, that's not good. That means it may be a bad mic, so we may need to see. Hopefully, maybe let me see if I can put my headset on and see if that works at all. See if that works any better. Tell me if, let me see if this works any better. You may have to reset to get this mic to work. Let me see if it pulls in here. It may or may not. Let me see what's going on. Nope. You know what? Can you hear me any better now? Did it change it at all? Or are you still having trouble hearing? Hey, Marcy, how are you? Apparently the sound is hard to hear. Oh, loud and clear, says Scott. Okay. So if you can hear me well, then that's good. Anyway, I thought I would answer some questions in regards to the coronavirus, in regards to ketogenic diets and how they affect it and what's happening. So hopefully I can help it out. Hey, keto, there's Jack. How are you? Anyway, so a couple basics. What is the coronavirus? Well, coronavirus is one of many RNA-type viruses. It's a class of family of viruses that usually cause the common cold. And so initially, when we first heard about this, we thought, oh, it's just a common cold. Why are we worried about it so much? And that's one of the reasons that people were so poo-pooing it. This is the common cold. Why are we worried? What's going on? So it wasn't really a worry initially. But what started happening is we started seeing double pneumonias arise almost immediately within a couple of days of getting this virus, and then some end organ failure, which means that your liver and your kidneys start to fail, specifically the kidneys initially, but also often what we call end organ, which means all the organs end up failing. Now, this usually happened in patients that were over 55, and this, we knew, as you are well aware, this started in China from what they thought as an epicenter within a market in Wuhan, China. It spread into Korea, it spread into Italy, as you've seen. And the concern arising in this is that this is a variant. It's not the same type of RNA virus, hey Rhonda and hey Mark, that arise with the common cold. It's actually more aggressive. It actually enters the cells of the body through what's called the ACE, the ARB. There's an entry point that our kidneys use for a number of signaling hormones, and this particular virus enters through that signaling port in most cells. And so that's why it seemed to have some effect on the kidneys. Initially, they thought that using some kidney medicines would help it, and it didn't. Now, the interesting thing is that well, let me back up a little further. This virus affects middle-aged people and older patients. Anyone under age 20, it doesn't seem to bother. They get a little cold, like symptoms. It lasts 24 to 48 hours and it's gone. They may have a low-grade fever, but nothing major. So if you're 20 and younger, including children, you're fairly safe from any major consequences or sequelae from this particular virus, which is actually nice. So we're not worried about our kids. We're not worried about our younger children. Even our young adults under 20 do quite well. So they actually are doing very, very well. Hey, Amy, how are you? So if you have questions about this, pop them in or hold them, and I'll try to catch them at the end. If I don't see your question, I'll try to answer it, but I do want to make sure people are aware of this. I had a lot of this information on my website, and my website went down at midnight last night. And so I thought I would do a video. I will take this video and probably roll it up to YouTube after I'm done here, so it maybe take an hour or two to roll it up, but I'll put it on there. But I wanted to answer your questions and do a live for you. And I thought I'd try my iPad to see if this video was any clearer or if the sound was any better. We'll see which medium seems to work better. I have a camera, but my camera seems to be grainy and it's harder to see. So people are asking, then why are they closing schools? Well, interesting enough, if you look at some data, and it is available on my website at docmuscles.com, the article I wrote is on the front page there as they're repairing the back end of my website. Anyway, what we know is that when you quarantine or you self-quarantine and you're very aggressive about not having large amounts of contact with others, they did this in Japan, they did this in Korea, and they did this in Taiwan, they noticed that the virus did not spread. And so because we thought initially it wasn't a very bad virus, and then we were caught off guard by the fact that this rapidly spread through Korea and China and Italy, and that the mortality rate was not just 0.5%, which is normally like what we see with the flu, but up to 3 to 4% of the population. That's where things started getting edgy. So, and then the other issue is that a study that came out about 5 days ago, published in the Lancet, showed that those that had the highest mortality, meaning those that ended up dying from this particular infection, because what this virus does is it attacks, causes a double pneumonia within about 5 to 7 days after feeling fatigued, low-grade fever, and either headache or malaise, meaning body aches. Those are the first most common symptoms that seem to kick in. Some people have a little bit of a runny nose, but it's not always the case. But what we see is those common three can occur, then fairly rapidly progress to a double pneumonia, and then great sickness that ends up putting people into the hospital. And people need to be on ventilators because it causes what's called ARDS, which is acute respiratory distress syndrome, and can be life-threatening for those that are 55 and older. The interesting factor was that those that seem to be most susceptible to the severity of this particular illness had high levels of something called interleukin-6 and high levels of CRP. Now, CRP stands for C-reactive protein. This is an acute phase reactant that's produced by the liver. It's produced by the liver in response to infection or major stress or major inflammation. And interleukin-6 is produced by a number of cells in the body, but predominantly by the fat cells. And what we know is that the fat cells overproduce interleukin-6 in response to high levels of insulin. So if your insulin level is high, like you have prediabetes, metabolic syndrome, insulin resistance, or what we call hyperinsulinemia, where you overproduce insulin, which is the common predisposing factor to about 85% of the people in my practice, that starts 20 years before you ever become a type 2 diabetic, those are the people that are most susceptible to this. So that's 85% of the population that I see in my office, which is very, very concerning. Someone says the volume is low. Hopefully you can hear me. I don't know if it's just this microphone or what exactly it is, but hopefully it's coming through. So the biggest challenge that arises is that because of the increased, the rapidness that this spreads, because this is a strain that causes more aggressive problems, and because of the susceptibility of patients who have metabolic syndrome, prediabetes, things like that, then it becomes a major problem in regards to risk factors. So what do we know works to stop the spread of this virus? Well, number one, washing your hands. Number two, avoiding large groups and contact with people that may have been exposed to the virus. And using common cleanliness techniques. If you feel sick or you've been sick, then you want to get checked by your doctor, get screened. Most of those that are feeling sick right now are either parainfluenza virus, influenza A and B, or those are the two that I see. Parainfluenza virus seems to cause this runny nose and congestion and sinus infection and bronchitis, and I've seen cases of that incessantly over the last six weeks. And I've had multiple cases of influenza A and B come through my office as well. But if you've been exposed to someone with coronavirus, if you've traveled outside the country, if you've been to any of these areas where you've been exposed with potential exposure to someone, then I absolutely want you to get checked out by your doctor. And it's a simple nasal swab. It's a little Q-tip that's very thin that goes up into the nose. You swab it around, and we send it off to a lab that can do the test. So hopefully that helps you understand. So what am I recommending people do? Well, let me back up even further. The way to prevent severity of infection is to, based on what we're seeing from this Lancet article, is that if your interleukin-6 levels and your CRP levels are down around normal or baseline, you're much less likely to have any problem with this. And it seems to run its course like the common cold. If those are higher, then you're probably more susceptible to significant illness. Now, how do you lower interleukin-6 and CRP? You follow a ketogenic lifestyle. You lower your insulin response to starches and sugars. Not eating starches and sugars, those of us that are doing carnivore, ketogenic diets or intermittent fasting find that it actually naturally lowers the CRP and the interleukin-6. So a good, healthy ketogenic type diet, whichever one is your flavor of the month is great, but they all seem to be effective in lowering that, reducing your weight. As the fat cells shrink, they produce less and less interleukin-6, and you become less and less insulin resistant. Amazingly, the CRP and the interleukin-6 begin to respond improvingly within about 3 days of changing up your diet. So that's actually really important to understand, and hopefully that is clear. Now, should you panic? No. Should you be overly worried that everyone is going to die? No. But the reason that we're doing what we're doing and we're quarantining, the reason I'm a big proponent of self-quarantining and limiting exposures to large groups, like a number of churches have done and sporting events have done, is that we know that just the contact, because this is spread through if you touch your mouth and then shake a hand, if you cough about 6 to 8 feet, those droplets can be spread through a cough or through air about 6 to 8 feet. Or if you come in contact with body fluids of some sort that way, that's how it spreads. The virus can exist on the surface for 24 to 48 hours. So that's why we're having people use, wash your hands after you touch the surface, don't touch your face. If you happen to have to go to the grocery store to hunt down toilet paper that's on on sale somewhere, then make sure you wipe off your your shopping cart with a Clorox wipe or something that has 60% alcohol base. We know that Clorox or alcohol base that's greater than 60% kills the virus within about 10 seconds. So just general cleanliness techniques solve the problem. If someone's ill, that person should wear a mask and get checked out by their doctor. So those are all things that hopefully will be very helpful for you. Hopefully this isn't worrying you, it's not stressing you out. Hopefully it's not causing you undue anxiety, other than we're just saying, hey, we've shown in 3 different countries, Japan, Taiwan, and I think South Korea, that reducing exposures this way and adopting cleanliness techniques appropriately, washing your hands, washing down surfaces with a good sterilizing agent that has Clorox or alcohol in it, prevents the spread of this disease very easily. And so that's the important thing to see. And an important thing to understand. So hopefully that is helpful. Any tips for shopping? If you've got to go to the grocery store, I'm not telling people don't go. I'm just saying, try to limit your exposure to larger crowds, big groups of more than 20 or 50 people. If you have to go to the grocery store, my suggestion is when you walk in there, most of the grocery stores right now are giving out Clorox wipes or the handy wipes that have alcohol in them. Wipe off your hands, wipe off the shopping cart. If somebody's coughing, avoid them. And if it's someone you don't know, my suggestion is try to avoid shaking hands with people you don't know or people that may be ill. There's nothing wrong with fist bumping or elbow bumping, but even when you get into that space of 6 feet and someone's ill, if they happen to have that virus, the potential's there. Will wearing a mask help you? Unfortunately, it won't. However, if the person who's sick is wearing the mask and they cough or breathe heavy, it catches the particles. So if a patient comes into my office, we're all wearing gloves, and I put the mask on the patient because the patient is the one that actually can spread it, not you and I. So hopefully that helps a little bit. I have a little worry because my immune system is compromised from lupus. Any extra precautions? If you're sick, if you have a compromised immune system, be aware that your ketogenic lifestyle, your low-carb diet, lowers those inflammatory markers. If your CRP is under 3, you're probably fine. So if you have lupus and your CRP is at a normal level, that's great. If you have lupus and it's not or an autoimmune disease that may be out of control, then I would probably send your husband or a family member to do shopping during this period of time. Have someone else go and do that's not immunocompromised. Can you take a walk? Absolutely. In fact, we know that when the flu actually hit in the early 1900s, before we had antibiotics in the 1910, 1920, one of the treatments for flu was actually putting you outside in the sunlight. And it was effective. Those that actually were out in the sunlight actually got better faster than those that didn't. And the reason is that vitamin D and the sun exposure and the fresh air stimulates your immune system even more effectively. So today I went out, fed my horses, sat in the sun a little bit, and did all those exciting, fun things. That works for any viral illness, including the flu, including the para-influenza virus that we're seeing, things of that nature. Getting an appointment is difficult. I've tried, have dry burning eyes though, headache, no fever, should I wait? Dry burning eyes is, in many cases, maybe more of an allergy, so those are things that I wouldn't be horribly worried about. But again, get checked out by your doctor if you have any questions. I'm going to try to catch some of these questions. Being asthmatic at age 45 and hypothyroid put me at higher risk, or does it put me at higher risk? Both are controlled. If your asthma is controlled, if your thyroid illness is controlled, I'm not worried that you're immunocompromised. One of the ways we know is that if your white cell counts are elevated, that's your WBC count. If you're anemic currently, or if your CRP level, that's C-reactive protein, is elevated, or your sedimentation rate, which is another marker of inflammation, are elevated, then those are people that may be immunocompromised. If you have a lung disease that's like COPD or emphysema that's not fully under control, you're probably at risk for exposure. So again, you want to limit exposures in large groups. Hopefully that helps. Raymond, I know there was more questions. I'm going to try to pan back here and see if I can pick up some of them. You guys are asking great questions, by the way. Any other questions I can answer? Let's see. Was told to gargle twice a day, as it's supposed to live in your throat for 3 to 5 days. That's Mark. I don't know who told you that. This is an infection that actually gets in through either the nose or the mouth. Gargling does absolutely nothing for you. And in fact, they actually showed that gargling does have some suppressive effect on some of the good gut bacteria. So I'm not a big fan of gargling Listerine. We've been wonderfully brainwashed by the toothpaste companies and the Listerine companies and gargling. There actually is no good data to support that it actually it does anything more than drinking water does. To be frank, tracheal stenosis. I'm not. If you have it, I'm not quite sure if you're asking a question there, Sharon, but that's I understand that. Sherry says had MRSA in 2018, ICU 5 days, hospital 3 weeks, an active illness that's not under good control currently, if that makes sense, or if you have a lung disease that's not under good control, Sherry. So if you've healed from those, then I'm not worried about that. Thoughts about mast cell activation disorder? Who owns and works in long-term? Oops, I missed that. Long-term care. As long as your mast cell activation disorder is your body trying to treat infection or inflammation. If it's under control, you're probably good. If it's not under control, then you're going to want to take precautions, if that makes sense. CRP level, where would I see this on a blood test? It is specifically has to be ordered. It's called a C-reactive protein, or CRP, Debbie. Will exogenous ketones help to lower the CRP on interleukin 6? I have seen anecdotally, Bobby, that exogenous ketones do lower CRP. I have not seen any data to show that it lowers interleukin 6, although we know that the presence of ketones in the blood has a suppressive effect on interleukin 6, interleukin 1, tumor necrosis factor alpha, and CRP. So my suspicion is that they do, but I have not seen any data to confirm that. 49, school teacher, diabetic with a heart stent, high blood pressure. If your diabetes is under control and your blood pressure is under control, Billy, then you should be good. But if they're not under control, then you're at risk with your immune system, and so you want to try to get those under control. And the most important way in my office that I have patients get under control is stop eating carbs. That's the most important. Immune boosters like elderberry. Elderberry was shown not to decrease the interleukin 6, so there's a study that shows that is not effective. Echinacea only works for 7 days, so I don't recommend continuous echinacea. If you're using echinacea longer than 7 days, it has no effect, as golden seal. Lysine, again, this is these are only effective if you take them and when you immediately start to feel sick. If they have a slight enhancement to the immune system, but beyond that, they're not effective. For about 7 days, essentially, Jessica. Scheduled for back surgery Thursday. Odds of it being canceled. It really depends on where you're at, Joyce. If you're not in an area that is being overrun by this virus, then you're probably fine. If you're in an area, one of the epicenters right now, like Seattle and New York and I'm trying to think of where else the larger areas are at. Those areas, they may actually, depending on the hospital, may cancel some of those surgeries next week, depending on what numbers occur. Really, in the next couple of days is where we're going to see if our quarantining ourselves and limiting our exposures over the last few days has been effective. Remember, this virus doubles every 4 days. So if there's 1,000, like right now, let's say there's 1,000 in the United States right now. In 4 days, it'll be 2,000. In 4 days, it'll be 4,000. In 4 days, it'll be 8,000. And so that's what you're seeing. Like in Italy right now, their numbers went from 100 dead to over 2,000 dead in the last week. And so that's where this gets a little bit edgy and a little scary, is that if we're not limiting exposures and we're allowing this to pass, and then you have patients that have elevated CRPs and interleukin 6, because of these other disease processes like obesity, hypertension, diabetes, coronary disease. That's where we start to see this be a problem. So that's why I jumped on the bandwagon about 4 days ago and said, I really do think that self-quarantine is a good idea in that regard. And so it really depends on that epicenter and where you're at, where you live at. Narrowing the airway. If it's related to an asthmatic type approach, Sharon, I understand that. Are essential oils helpful? The only essential oil that I think is truly helpful from the science is bacon grease, and I use that to cook my eggs. That's the essential oil that I find to be helpful. I am not a fan of essential oils. I have not seen any positive effect other than making someone feel good because of the the aroma, to be honest, and I'm going to be frank about that. I have so many patients come in that have allergic reactions to essential oils. It's horrible. All the Lysol spraying has caused my asthma to trigger. Okay, so a lot of Lysol spraying, the chemicals that are in Lysol could trigger some bronchitis issues, so make sure you're taking your inhalers if you have that. And my light just shut off on my computer. Hopefully that's helpful for you. All right, and my wife is in the background making something. You can hear. She's making something yummy. It sounds good. I'll keep my nose moisturizer with saline spray. That works really well. You know, and if you're stuffy in the nose, I find that the saline rinses like the Neilmed, Neilmed, you can buy over the counter, are wonderful. Just a daily rinse in the shower. It's basically squirting water up into your sinuses. That's warm water and salt, and it works really well. You know that those are actually really effective for a lot of the other things. If you find out you might have been exposed, if you think you've been exposed, then go see your doctor immediately and find out where they want you to get tested. It's a very simple nasal swab. Takes about 24 to 48 hours to get the results back. I know they've got some more rapid testing that's coming out. I have not seen in my state where those are available yet. I've run 3 tests on patients in the last week because I've had patients that came in from other countries. 2 of those have been negative. I'm waiting on the last one, which hopefully is negative, but we'll see. Those are some exposures that I have. I have 2 patients that actually have siblings that were on the ship that had 619 cases of coronavirus. So I know that we've got some direct relationship in those. And so I've been very vigilant in trying to understand how to test for this and how to prevent it. 18-year-old son is hyperinsulin with Hashimoto's. Again, keeping that diet under control and keeping those diet plays the biggest role in raising CRP and insulin resistance, or interleukin 6 in my office. What was the study that you mentioned, the Lancet? It came out 5 days ago. It's in my blog. If you go to docmuscles.com, it's actually the first. It's the paper that comes up that I talk about it on my blog there, April. And I don't have the reference to it right offhand because it's in my blog. But it was a study of 191 patients in 2 centers in China, looking at all of their data that came off of their testing with these patients, whether they survived or didn't survive, and what their levels were. And the 2 factors that were big flag was that CRP and interleukin 6 were double in those patients that ended up passing away. And that's what worried me, is because I commonly see those 2 elements elevated in my hypertensive, insulin resistant, or hyperinsulinemic, diabetic and pre-diabetic patients, and those with heart disease, coronary disease, because insulin is the driver for those inflammatory markers, and when those inflammatory markers are up, this particular virus seems to be more aggressive, if that makes sense. Less lesion on spleen with asthma. I'm not so worried about lesion on the spleen if they're benign, but with the asthma, again, if it's not under control, that's a risk issue. Pregnancy is not an issue as far as we know. Mom is producing lots of antibodies, and if mom's young, mom's probably more healthy. Metformin, helpful for this? No. Metformin is just helping you to control the blood sugar. It doesn't necessarily have an effect on CR. Well, let me back up. In a roundabout way, if your metformin is helping you to control your blood sugar, then there may be some benefit. But I've never seen a study showing that metformin lowers CRP. What lowers CRP is taking in less starch and needing to produce less insulin from your body, if that makes sense. Drive a commuter train in Santa Rosa, California. Bathe in hand sanitizer. Hand sanitizer is great, Scott, but if you don't have, I would do soap and water first. If you don't have access to soap and water, use a hand sanitizer, and that's perfect. So that should hopefully help you. Joyce is in Ohio. Are you telling my family? What have I done with my family? I told my family, don't travel, don't go anywhere if you don't need to go anywhere, don't go to any large groups. My church actually shut down, so we're not going to church. We held our little church service here in our home today. I have to go to work, so I'm going to see my patients, but I've given my office protocols to follow for anyone who is ill. And so I'm going to be at work all week this week taking care of patients, but my wife and daughter are going to stay home for the most part. If they go shopping, they're using handy wipes and hand sanitizers. They're washing their hands. They're trying to avoid touching their face. They've been instructed not to get in contact with anybody who has had recent travel out of the country or things of that nature. That's really what we're doing. And then we're eating bacon and ribeyes. In fact, there are ribeyes on my smoker right now that I need to go pull off because they're probably almost done. And so a ketogenic lifestyle lowers your insulin response and allows those interleukin-6 and that CRP to lower. You are very welcome, Billy. I hope this has been helpful for you guys that are watching. Stay home, eat bacon, and ride horses. That's actually about what I would recommend for most people if you have horses. All right, ketogenic diet, 11 months, down 80 pounds. That's awesome. Carnivore is essentially a form of a ketogenic diet, although if you eat excessive amounts of protein, it actually does kick you out of ketosis. So be aware of that. Not all carnivore is truly ketogenic, but it is beneficial because it's diminishing the insulin response from carbs. Home treatment other than keto. I'm not sure what you're referring to in regards to home treatment. Treatment for what, Amy? I'm not quite sure what you're asking. Do I have a cold? I actually had parainfluenza virus 2 weeks ago and have had a stuffy nose since then, was on antibiotics, feeling much better now, but no, I don't have coronavirus. Let's see. Bacon grease is the only essential oil. Yes, it is. Oh, I must be behind. All right, Stephanie, how are you? Let's see. Where are you? I am in my home. Usually, if you watch my videos, you can see my bookshelf behind me, but I'm on my iPad. I was testing that, and apparently the sound is not so great. So I'll probably go back to my other camera. What lab is doing the testing? LabCorp has had this test available, so I've been using LabCorp all week. Apparently, Sonora Quest will have the lab available. It's called Quest in other places. Here we call it Sonora Quest. They'll have the lab available tomorrow, I've been told. My appointment this week is not about a physical illness. Do you have the option to Skype? I actually have telemedicine available as of Friday through my website, which is really cool, but not all insurance is covering it unless you have an illness that we deem you need to stay home for. So I can do an online telemedicine visit through my eClinicalWorks software. However, your insurance might not cover it, so be aware of that. I think that might be the last. That or my fingers not rolling the slides forward here. There we go. Let's see. Drinking water to keep throat moist. Yes, that's great. Let's see here. You are very welcome, guys. I am going to sign off and go get my ribeyes off the grill. Hopefully I cut all the good questions. Should we trust coronavirus data on MedRx IV or written by doctors not yet peer-reviewed? There's not a whole lot of peer-reviewed anything out there on this, unfortunately. So what we're looking at right now really is the data that came from authors in China and South Korea. And the data that gathered from them is not perfect. So again, we're really wondering about some of the data. That's why that's why I think the response has been somewhat slow. It's been hard to know what data to truly trust. But again, the data we're seeing is enough that to help us make decisions in regards to social space limiting, washing your hands, things of that nature. You are very welcome, Kimmy. Hopefully things are going well. Dave and I are staying here in northern Michigan. Good health. Perfect. All right. If I was drinking alcohol, would taking a shot every time you say bacon. Oh, okay. I hope you feel good now, Manuel. How long will this virus be around? This virus may linger through May. Depending on, if you look at the trajectory numbers, it could be around through May. So that's where these are precautions that I don't think are going to go away tomorrow. They're things that we need to be aware of. You are welcome for the live. I'm going to try to do more lives as we go here. Let's see. I can't travel and enjoy my part of whatever we have on the barbecue. Okay, good. All right. Well, you guys, I'm going to sign off here. I'm just trying to check to see if there's any other burning questions. It looks like I caught them all. I'm going to go enjoy my ribeye. You guys have a great evening, a wonderful Sunday, a great Sabbath. Remember, keep the fat high, keep the carbs low, because it lowers your CRP and your interleukin-6, and pass the bacon if you've got some. And we'll talk to you soon. Have a great evening. Talk to you later. Bye.